Hey all, Keith Little, Balanced Body Mind. Today I just want to drop a brief note about core and core training because it's one of the most misunderstood concepts around. Many people often spend lots of time putting on Facebook that they've managed to hold the plank for 3-5 minutes or 10 days, whatever, putting weights on their back to seeing how long they can hold it for. This does not create good core function. In fact, these type of exercises go some way to obliterating the core and stabilisation because it tends to cause compensation and rigidity, and that's not what the body's about. The body's about combining mobility with stability. Let's talk about what the core actually is. We have the intrinsic stabilising system, which is combined of the diaphragm, which is a muscle of inspiration, which is also used for stabilisation. We also have the transversus abdominis, this kind of hoop-like muscle. We also have the pelvic floor. Now, certain other muscles combine with that to create stability, such as the obliques, the back muscles, the multifidus, and also maybe the upper so-called diaphragm that's combined with the neck muscles, such as the scalenes. Now, understanding how these all interact together is more than likely going to give you the guidelines that you need to create a good, stable core. Anytime you choose to train your body to have a good six-pack, to have more strength and stability, this is where your core is going to break down and you're going to get back pain. So next time you're thinking about your program and what you're trying to do, think about, can you breathe properly? The most important thing to having a good, stable core. Do you have pain when you're doing these exercises at the expense of trying to get a six-pack? All of these exercises will create instability if you do not have a good stable core to work upon. And there are other factors as well. Consider that if you have an ankle injury, a shoulder injury, all of these aspects that have the capacity to produce pain can shut down other muscles and ultimately the core. The diaphragm, the way that you breathe, is one of the most important factors in stabilisation. Drawing your belly button in all the time creates dysfunction between your diaphragm and your transversus. Get someone who can measure what's going on there, see the implications on the rest of the body, and you're most likely going to get out of pain a lot quicker than you think.